Hello and welcome to the October Board podcast. I'm speaking from the Exchange where we've just completed the board meeting for October. It was a shorter meeting than usual because we've recently moved to a new arrangement for board meetings. We have board meetings now every month, and those months when we also have a board away day, we have a shorter public board meeting. I think it was pretty well received by the non-executives and the executive team, and hopefully it will enable more colleagues from across the organisation to attend board meetings and observe what goes on than has been the case in the past. A few things to highlight. There was a League of Friends forum earlier this month which I attended and spoke to colleagues from I think 6 of our 13 Leagues of Friends regarding the sustainability and transformation plan for Somerset and the likely changes that that will mean in terms of delivering more care out of hospital and focusing far more on prevention and promotion. I also informed the board that Vanda Squire, who is our staff side chairman, will be retiring at the end of this month and therefore stepping down from her position as staff side chair. And I'd like to take this opportunity to thank Vanda for all she has done and for the support she has provided me since I've been Chief Executive. Pippa Moja presented an overview of the Trust's finances and also an update regarding certain initiatives in relation to our IMNT service. I was particularly pleased to hear of the feedback we've received to date in relation to the end of bed care. As some of you will be aware, this is using iPads so that nurses can enter information regarding patient observation immediately onto Rio using an iPad. We've also now rolled out nearly 150 smartphones to colleagues working in community services, and the feedback from them so far seems to be pretty positive, which again is good news. Andrew Diani, the Trust Medical Director, informed the board regarding the latest recruitment campaign to try and ensure that we fill the vacancies we currently have across our medical workforce, and it's encouraging that we've received a good response to this, with a number of people approaching the Trust and expressing an interest as joining as either a consultant or as an SAS doctor. Phil Bryce, in his capacity as Director of Strategy and Corporate Affairs, informed the board regarding the recent report published by the Care Quality Commission regarding state of care nationally. Unfortunately, this report still includes community services with acute hospital care, so our community services, like those of other trusts, are still not rated separately, which is, I think, a gap in the inspection regime and the reporting framework. Sue Balcombe, our Director of Nursing, amongst many things in her report, highlighted that Liz Berry, who is our Senior Nurse for Clinical Practice, has been invited to visit the House of Commons by Sepsis UK in recognition of the work she has been leading in relation to identify deteriorating patients, particularly in mental health settings, and I'd like to congratulate Liz for all she has done in this regard. As is always the case, the Trust received a detailed quality report looking at the quality of care we provide across the organisation, including the incidence of pressure ulcers, falls, restraint, and incidents of violence. I'm pleased to say this was a largely positive report, although clearly there is more work that we need to do in terms of reducing the use of restraint and also reducing the number of pressure ulcers, especially out of hospital. Next month, the Trust is going to move to having an integrated performance report presented at the board, which will include both quality and performance indicators, because obviously the two are not entirely separate and there's a clear overlap. And this is something that Lee Cornell, in his capacity as Associate Director for Performance and Business Management, will be leading on. Next month's board meeting will be at Frome Community Hospital on the 22nd of November, and again I would like to extend an invitation to all colleagues to attend the public part of the meeting. It's really great if we can see colleagues from across the organisation coming to observe what we do as a board, and there's also an opportunity for you to put questions to the board regarding any matters arising from the board papers. And the board papers will be available, as always, via the Trust website and the intranet. Thank you very much.